place your hand is only one hand. So you don't use two hands. It's only one hand. And it's the same rate, 30 to 2. Okay? So you just do that. And after 30, you can do, if it's your own child, then you would have probably want to do the rescue breath. Right? If it's someone else that you find as a child by the side of the road, then you just continue doing chest compressions. Interestingly, during COVID, the COVID precautions only apply in adults, not in children. So they still recommend you do rescue breathing in children. Okay? Because in children, the commonest cause of an arrest, stop in circulation, is a respiratory cause. So it can be from choking, it can be from asthma, it can be from pneumonia, chest infection, any of this. So if you don't give the rescue breath, you're not actually treating the cause, but you need to get oxygen into the patient. That's why you have to give the rescue breaths. So that's pretty much it. The only difference is one hand, the same rate, 30 to 2. Okay? I go to the infants. Sorry, one other thing. For choking, again, is the same thing. You do the Heimlich maneuver, just this one. Sometimes you just need to use the one hand, don't put the other hand on top, just push the one hand. And you can do the back blows as well. Obviously it has to be a bit more gentle.
Alright everybody, thank you. It looks like everyone's having a really productive time. I'm just going to ask for your attention again. Now I know that some of the trainers have been doing fantastic jobs of moving forward with the next steps, which is the recovery position and the choking patients. And I think that's brilliant. I'd just like to know if anyone does not know how to do the recovery position. Imran, have you taught it already? Good. So, if anyone who has not been taught the recovery position for someone who is unconscious but is breathing, I'd like you to come towards the front of the hall so we can teach you. So, all the people over here know it? Excellent. So I'll double check at the back.
Okay, so we'll go to the infants.
Ladies at the back.
So infants,
sorry to interrupt.
Is anyone
have you guys
under the age of 1? Okay. So obviously you can't. The same thing applies. Look for danger, responsiveness. The commonest cause again is something respiratory. So once you see the baby is not breathing, you start chest compressions, but only with 2 fingers.
Have you taught the recovery position?
The rate is 15 to 2. So it's half the rate of the child and half the rate of the adult.
No,
so 15. Once you do 15, you do 2 rescue breaths. The breathing is your entire mouth will have to be over the baby's mouth and nose. Okay, so you have to cover the mouth and nose. You don't do the press the nose like the adult or the child. So you must cover this entire thing for the rescue breaths. So you do 15, and then you do 2 rescue breaths. Okay? Choking. This dummy is actually designed for choking. So what you do, you carry the infant, put 2 fingers to support the infant's jaw, like this. Okay? Lay the infant on your forearm and do the back blows. So you can see that.
That's sliding like that.
Directly on the back, between the shoulder blades. Okay? So it's quite easy because they're small, it's easier to do. And because children of this age, maybe around 2 to 3, they like to put things in their mouth, so it's the commonest cause that they can have a cardiac arrest. Usually it's respiratory. So yeah, that's the difference. Any question?
How do you hit from the back for the babies?
The same area, obviously it's smaller, so you probably won't be able to hit between the shoulder blades, just right in the middle of the back. Yeah. So you need to support the jaw. You make sure the head is tilted upwards. You don't want like this, because if you do it like this, it actually blocks the airway. You want airway up, resting, and hit that way. Okay?
How much force should be there?
What we're going to do now,
it's a bit hard to assess how much force.
You should move the chest. You should be feeling the children
and infants.
Going down.
Both choking
Is it the same as with toddler, like 1 or 2 years old? you have to put them.
Depends on the size. So if they're small enough for you to do this,
Okay.
then yes.
Just
If you
help.
can't,
There's a
then you
lot
just
of
do
people around
the
the infants. I
uh,
put the
head lick, but you can just use one hand.
One hand.
And I'll start showing CPR for children and choking children, not infants, that's babies. So if anyone would like to come that way, we can start splitting the process.
Anyone want to have a go?
Everyone just needs to finish off their recovery. Their hand.
Yes. Anyone with little children? Yes.
Yeah, let's move it together.
I'll grab it. Don't worry.
Be careful, don't put the children's eyes. Yeah, just there. Okay. Harder.
So if anyone, like of you would like to do children first,
Come up.
we'll get around to doing infants.
So it needs to be quite hard.
Just ladies who are finishing in the back, we're going to demonstrate children. Just like around the
Hey, I don't actually know there is a recovery position for
and
pediatrics.
then infants afterwards. If you have to leave one,
Ask Brother Saleh and see. Anyone else want to have a go? Yeah. So wait, no. Your fingers must support the jaw. Bring back towards.
Bigyan mo ako. Bigyan mo kami. Ako mo kayo.
In the middle. That's it, yes, okay. Good. This one actually gives some feedback that the thing has come up. That one is for bigger children. Yeah.
So, Brother Imran, maybe we show to the,
Ayan, yung baby.
yeah, after this one, we can come all there and see as a group. Just let Sister James finish.
On the jaw. 2 fingers on the jaw. Yeah. Harder.
Okay. Should be harder.
No, we won't do it.
Don't eat anything. Hard. Gusto mo, Han?
Yes. Depends whichever hand you're familiar with. Yeah. On the forearm, yes. Yes, okay, very good.
Ayun.
It's okay. Yep. This one has to be on your